Good morning, ladies and gentlemen. We come to you again with this our 23rd video presentation for you citizens of Randolph County. We're starting our 12th week, and as we always say, we hope that you're getting something from this. We think we have a nice informative program for you today. Dr. Mustafa, who's the county dentist within the health department, and I think you'll find it very informative and educational for the family, especially the children. And so we just encourage you to stay and watch the remainder of the video. We hope again that you get something from these videos. We've had some discussions about continuing, how long, and do we continue to do 2 a week. But so if you have any feedback, we would appreciate it. And but we have enjoyed bringing these videos to you, and I hope that you benefit from it, kind of know what's going on. This morning we have about 811 cases. We've had a couple since early this morning, 15 deaths. We had a pretty significant spike last week from Wednesday on through the end of the week, and we did have our 15th death, but the last couple of days have been a little more quiet. I would say, and just remind those of you that are involved in the marches and the social relative to the concerns that are going on within our community and across our nation today. We have had a case or two from the marches, so just be careful of your surroundings and as we go about it. I do want to compliment those that have been participating in the marches. It's been peaceful. We've not experienced the looting and the rioting that some of our other communities have seen. So thank you, and your voices are being heard, and we thank you for your professional way and again, considerate way that you go about that. Last night we officially began the budget process for our 2020-2021 budget. It is balanced right now with no tax increase. That's a difficult thing for us to do. We have about a $3.5 million hole to fill. Our biggest concern and question has to do with sales tax. That will be the greatest impact on revenue that we will have, on the potential for revenue. Do say we have done a good job in managing the finances of our county. We have a significant fund balance. We don't call it a rainy day fund, but it's not a rainy day, but it is good to have it available when we're looking at a revenue shortfall. Our existing programs, those two things are the additional jail staff once the expansion is completed, and also our decision to go to 12-hour shifts in EMS. That's important for those folks that are working there, as well as our ability to hire new help. So those two programs continue. Our capital programs that have been in process are continuing to be funded. That's the projects at Ashboro High School, the new middle school up in Trinity, and the jail expansion. We've been involved in those for the last 3 or 4 years, and we will continue to keep those on track until we finalize those. So just keep that in mind. We have another budget hearing this Thursday night, the 11th. We will hear from county agencies at that time on the 15th. Next Monday night, we will hear from the fire departments and from our nonprofit agencies here in the county who have requested some funding for us this year, from us this year. And also Monday night, the 15th, will be our public hearing on the budget. And then our next meeting will be on June the 25th. We've waited till the end of the month so that we can get as clear a picture as possible right now with what we think our revenue stream would look like. We will get another sales tax check this on the 15th, so give us some idea of what of a trend that we might see. So that's our budget process, and it is being streamed online live. It will also be available on YouTube and on Facebook. So we make that available to you also today. And again, thank you for allowing us to come into your homes today and present our video. and we will be back here Thursday morning for our 24th video. So with that, I'll leave you my little thought for the day, and I'm always mindful, and I know it has to do with aging, but the older I get, I find things that happened to me in my younger life that I think has helped to prepare me to serve you, to be a part of county government here, and not just as a county commissioner, but in life, at my employment, dealing with all types of individuals, 9 nationalities, different languages. But back when I was in the 4th grade, my 4th grade teacher was Mrs. Taylor. She was a great teacher, but more than that, just a wonderful person, and had a great influence in my life at that point, as we sort of getting a little older and wanting to get older faster, and but just had a great impact. And as we started that school year in the 4th grade, Miss Taylor said, we're going to learn a Bible verse for every letter of the alphabet. And so, of course, we began with the letter A. And I will tell you, of the 26 letters in the alphabet, the first one is the only one I remember, the letter A. And it came from Proverbs, the 15th chapter, and the 1st verse. And Solomon wrote, a soft answer turneth away wrath, but grievous words stir up anger. And in my 38 years of serving you in this position, my almost 50 years of employment and management, I've dealt with all kinds of personalities. And I've always found that a soft answer will get you to a resolution a whole lot quicker than a strife and becoming angry towards those that you might be dealing with. And I just think that, in a way, God in the 4th grade began to prepare me for what my future endeavors might be. Also with my children, to learn to respect them and their feelings. But it's been a great advantage to me and a benefit in my life. Soft answer turns away wrath, but grievous words stir up anger. So thank you for watching today. Stay for Dr. Mustafa, and of course Susan will come along with our report from the health department. And we hope that you have a great week, and God bless you each day. Thank you.
Good morning. Susan Hayes, Randolph County Public Health. Today's total number is 811. We have 623 individuals that we've released from isolation, and we have 15 deaths. North Carolina and Randolph County is experiencing increased community transmission. Last week we saw the greatest number in an entire week that we've had so far. The fact is, people are contagious before they realize it, and then sometimes people don't even have symptoms. So that is playing a very important part in the increase in positive cases that we're seeing. Today, the state released new testing guidelines, so it's critical that people who think they could have been exposed get tested. Those guidelines include anyone with symptoms suggestive of COVID-19, anybody who's a close contact to a known positive case, regardless of whether or not they have symptoms, populations with a higher risk of exposure or a higher risk of severe illness should they become sick should get tested if they think they've been exposed. And people who've attended protests, rallies, or other mass gatherings could have been exposed because, again, remember, I said you're contagious before you start symptoms, and sometimes you don't even have symptoms. And so those people really need to be tested. And you could go to a rally or a mass gathering, and you yourself could be sick and not even know it. So please get tested. Testing should be considered for any of these folks who've been in any of these kinds of crowded events and for any of those individuals that I mentioned earlier. I can't say it enough. Please continue to social distance. Please stay home if you're sick. Please stay home if you've been in contact with someone who's sick or with someone you know has COVID-19. And remember to please wear a mask, please wait at least 6 feet from others, and please wash your hands often for 20 seconds, or use hand sanitizer when you can't. Wash your hands. And please stay safe. Thank you.
Thank you so much, Commissioner Darrell Frye and Public Health Director Susan Hayes. It's hard to believe that today is Randolph County's 23rd update on the coronavirus pandemic. Almost 24,000 people have watched these videos, and we thank you for that, because information in a time of crisis can be a citizen's most valuable resource. As we've tried to spotlight the many Randolph County departments and agencies and organizations that are having a unique role in the many challenges faced by our community during this pandemic, the role of the Randolph County Department of Public Health has never been greater. They carry out their mission to preserve and protect and improve the health of our Randolph County community. And they carry out their mission in many ways. Some of those you see behind me in the Emergency Operations Center here at the Emergency Services Building. The Public Health Department collects and they disseminate health information, and they conduct health education programs aimed at the prevention of disease, protection of the environment, and the improvement of the quality of life for our citizens. You've previously been updated and received educational updates, not only from our Public Health Director, but also from our public health educators and our environmental health officers. And today, our next update will be provided by Dr. Mustafa. Dr. Mustafa is the Randolph County Public Health Dentist, and a major challenge of her public health dental program during this coronavirus pandemic is to provide emergency dental care, screening, preventive education, and clinical dental care to our preschool and our school-age children. Thank you, Dr. Mustafa, for being with us today.
Thank you, Hal, for the introduction. My name is Dr. Mustafa, and I'm the Dental Director at the Randolph County Public Health Department. We are located off of South Fayetteville Street. The mission and vision of our dental clinic is to promote, protect, and serve the citizens of Randolph County. We currently see children from age 0 through 21, and we see adults on an emergency basis. In addition to the precautions that we take at the health department, we have implemented some extra protocol to help with protecting our patients during COVID-19 in the dental setting. One of the first things we want to do is when you call us for your appointment, we would like to pre-screen you over the phone. We ask you a bunch of questions to make sure you don't have any symptoms as of COVID, and if you do, we will redirect you to the correct place. Once you pass that, we want to make sure that if you're a minor, you are allowed one guardian, and if you are an adult, we currently are only allowing the adult to come in unless there are some circumstances that may require some additional people. When you park in the dental clinic, we want you to call us to make sure that we are ready to receive you. When you do come in, we will have your temperature checked, and we will have a list of questions that we ask you just to make sure everyone is safe. When you walk into the dental clinic, you'll see that, there's less chairs and there's not the toy box, and we have little hand washing stations. This is all to protect you and to protect our staff in the community. So it's a little bit of changes that we're getting used to as well, but we want to make sure that this is the best for everyone. When you're in our chair, we have more protective equipment than we normally do. We have a lot more gear on, and this is again to make sure that the aerosols we use and the instruments we're using and everything is controlled in a controlled environment. In the health department, we have a very rigorous protocol for precautions in the dental setting. In addition to that, we are currently following the guidelines, and we have added some other measures to help protect the spread of COVID in our clinic. Other than that, there's some other protocol that I would recommend you do at home to help decrease your risk and to just maintain really good oral hygiene. You want to brush twice a day for 2 minutes at a time. The most important thing when you're brushing is to make sure that, one, you have a fluoridated toothpaste. Anything that has fluoride on it in the ingredients. So the first thing we want to talk about is a proper brushing technique. So when you're brushing, you want to have a systematic approach of getting all the teeth and all the surfaces. The first thing you want to do is make sure you angle your toothbrush at a 45-degree angle like so. You want to kind of gently just brush and you want to sweep out. So you want to keep your toothbrush here for maybe a couple seconds and sweep. When you're doing that sweeping motion, that's removing the plaque that's all around the gum line, a common area for people to miss. So what I tell my patients is, I want you to do all the front surfaces of your teeth. So I want you to go around and do all the front. This is just for the top teeth. And then I want you to get in there and get the chewing surfaces. So I want you to brush on the chewing spots like so. And then you always want to make sure you get the tongue side or the throat side that's up here. So again, you want to make sure you go kind of at a 45-degree angle like so and sweep up. When you get to your back teeth, which are the most common areas for cavities, you always want to make sure you put the toothbrush in your mouth and then you want to close your mouth a little bit. That closure of your mouth frees the cheek space so you can get all the way back here. And you want to just do like a nice horizontal motion like so. And you want to do that on all the sides of your teeth in the back. Also, another thing is when you do your front teeth, so up here and up here, you want to make sure on the back sides you're angling your toothbrush vertically like so. And then that's going to remove the plaque. Same thing here. And this is going to tickle a little bit because it's like near your throat, but you'll be fine. So that's basically all you do for the brushing technique, and you want to make sure you spend 2 minutes. Most people, they end up doing it really quickly and they're not spending enough time. So just make sure you give a minute for the top arch and a minute for the bottom arch. The next thing we want to talk about is flossing. So there are different kinds of flossers on the market. So these are more friendly for like younger kids, they're more colorful and they're easy to grasp. Whereas this is the most traditional we use for adults. You want to make sure you get a long piece of string. And there's also some other floss picks. These are more like they call Christmas tree flossers, and so these go in between your teeth. And then this is also a special floss for patients who have braces. It's very important that you're flossing and brushing, especially if you have braces, because this is the time that you're the most at risk for getting more cavities and getting white spots. So you want to make sure you prevent that by brushing really well. So the next thing you want to do is you want to get a pretty long piece of floss. Okay, and the reason you want a really long piece of floss is because you want to make sure each time you go into a tooth, you use a new piece of string, so you're hopping on the string. What I like to do is I put it on like my middle fingers and I kind of tighten it on one side, so I'll just go all the way so it's short on the other, so I'm making the most of my floss, okay? So one of the things that most people also forget is they don't get in this back area. So you want to make sure you start here and you get that back swooping motion because there's food that's stuck here, okay? Then you want to go to the next tooth and you want to hug it. So you see I'm kind of making like a C shape and getting under the gums. So you want to do that with both areas of the teeth. So you want to swipe up and then you want to go and do the same thing on the next tooth, and you want to use a new piece of string like so. So you see that and you see this hugging technique. And you kind of just slide a little bit up and down like so. And you want to do it the same on this side. One other thing that's pretty common is you might experience some bleeding when you are flossing. That's normal. You just need to give it a couple of days because there's a lot of bacteria there and there's different kind of inflammatory processes. So that'll get less and less the more you floss. Also, one last thing when you're brushing and flossing is to make sure you always get your tongue. So in this demonstration, it doesn't have a tongue, but normally you would want to stick your tongue out and either most toothbrushes have this kind of rubbery side. So if you have the rubbery side, you can use that and scrape it. You want to go from the back to the front because you don't want any of that stuff going inside your mouth. So you want to swipe it up like so. If you don't have this, you can use the bristle side. Just make sure you do it like this and then you rinse it off really well. Or another thing you can do is you can get like a tongue scraper. It looks kind of like a triangle, and that'll help with cleaning your tongue. Another thing I wanted to talk to you about is there's different other interdental flossers. So this is more for kids. So it's kind of the same concept that you want to make sure you get back here like so, and then you want to go in and hug. And you want to kind of hug like so. So this one is going to help with kids just getting used to it and just getting very comfortable. And there's also a lot of adults who like using this instead of the traditional floss. And you just make sure you're going all the way down.